So moving into our transition semester, our class, and specifically my presentation group, has been learning about managing conflict in nursing, be it nurse on nurse, nurse on patient, or nurse on physician. As you have extensive experience working alongside doctors of many specialties, my group would ask that you focus on a particular example of conflict that involved yourself and a physician. In your experience, is there any single incident that stands out in your mind?
Actually, there is. I had an incident with a surgeon a number of years ago. I was conducting an IV sedation basically for local hand surgery. The surgeon had, after sedation, injected the patient with a numbing agent, done his operation, which probably took about 10 or 15 minutes, and I was reducing my anesthetic agent and letting the patient lighten up in preparation for finishing the case, at which point the physician said, I'm going to inject more local for pain control post-operatively. And myself knowing that this is a stimulating process, the surgery is winding down, the sutures don't hurt much, but if you put a needle in and inject local at this point, it's going to be more painful than the surgery is at this point in time. So I felt that I needed to give a little more anesthetic agent, and so I asked him to take a moment and let me give some more propofol. And while I was discussing this with him, I was drawing it up and preparing to inject it into the IV. At the time, we were using a needle system, so I had to actually put a large bore 16-gauge needle into an IV port. And he said, no, the patient doesn't need anything else. It'll be fine. And as I was reaching for the port to insert the needle, he poked the needle into the patient's hand, basically, and injected a local. Of course, the patient flailed her arms and drove a needle through my finger. She struck the syringe or my hand, I don't remember which, but I got punctured with a 16-gauge needle pretty deeply, and it bled significantly. I uttered a few words that I probably shouldn't have, but it was not a good situation at the time. And we finished the case, patient was fine, moved her to recovery. Later, between cases, basically, I went into the doctor's lounge and found the surgeon doing his notes and approached him and said, I need to talk with you about what happened in the room. And he said, what do you want to talk about? And I said, well, do you trust me to provide anesthesia for your patients? And he said, absolutely I do. And I said, well, I would ask you to allow me to be the judge of when and if this patient needs further sedation when we're doing a case. He got a little belligerent with me, got a little red in the face, and went to the I'm the captain of the ship philosophy, which, in point of fact, he is, but he has hired me to take care of the anesthesia portion of the procedure so that he may concentrate on his surgery. And to me, that's why I'm there. And I said, again, I would ask you, when I'm working with you in the future, if I need to make an anesthesia decision, let me make that decision. I don't ask you or tell you surgical decisions. Allow me to do the anesthesia decision. And so he was okay after that, and from that point forward, we've worked together for a number of years since, and there's never been another issue. But these things do arise almost on a daily basis in my practice.